Welcome, everyone, and thank you so much for joining us today for our webinar, Measuring What Matters, Turning KPIs into Strategic Drivers of Philanthropy. My name is Greta Daniels. I'm the Senior Vice President here at Global for Sales and Marketing, and I'm really excited to have you all here today. Before we get started, I just wanted to bring a few housekeeping items up so that we can cover that and make sure everybody feels comfortable and ready to go. We'd love to hear from you throughout the session. You can submit questions at any time using the Q&A panel. Look for that Q&A button at the bottom of your screen. I'll be monitoring it throughout the session, and I'll either bring those questions up throughout, with our experts here, or we'll address them at the end of the session. So feel free to keep adding those in as we go. We've also got the chat window open for general comments and conversation, so feel free to add some comments and ideas and thoughts, in the chats as we continue through the webinar. I'll be keeping an eye on both of those things so that I can make sure that we're incorporating that into the conversation. We want you to know that today's webinar is being recorded. A link to the recording, along with a copy of the slides, will be shared with all of the registered attendees following the event. So don't worry about capturing everything right now. You'll get a copy at the end. Quick note on tech. If you're experiencing any audio or video issues during the webinar, here are a few things to try. First, try leaving the Zoom meeting and rejoining using the same link. If audio is the issue, check that Zoom has permission to use your microphone or speaker, or try switching your audio output in Zoom's audio settings. If you're still having trouble, you can always dial in by phone using the number provided in your Zoom invitation, and that'll get you the audio right away. And again, don't forget that you're going to get a copy of the recording so that in case there's any disruption, you'll definitely be able to pick up the slack later. Today's session is going to be a really rich conversation, and I'm genuinely excited about the expertise that we have in the room, or rather on the screen today. Before we dive in, I want to take a moment to introduce our two presenters. First, I'd like to welcome Erin Thompson. Erin serves as the Director of Foundation and Healthcare Philanthropy at Broder and Medical College of Wisconsin, where she leads fundraising initiatives and shapes grateful patient philanthropy strategy at the institutional level. What makes Erin's perspective especially valuable is the range of experience she brings to the table. Her background spans higher education, healthcare, and startup operations, giving her a really unique collaborative and strategic lens from which she looks at all of this work. She's known for her ability to align philanthropic programs with organizational mission, patient experience, and long-term institutional goals. We're so excited to have her with us today. Welcome, Erin. And joining Erin is Adrian Stover. He's our Associate Vice President of Services here at Global. Adrian brings more than 15 years of experience in healthcare philanthropy. He got his start with the Sisters of Charity Health System in Cleveland and has since held leadership roles at Trinity Health System and the University of Washington Medicine, where he served as the inaugural director for faculty and clinician engagement. So he's got a lot of experience that will be really helpful for today's conversation. Adrian has served as facilitator for AHP's Grateful Patient Roundtable, serves on the Marketing and Communications Committee for Men of Color and Development, and is a recipient of AHP's prestigious 40 Under 40 recognition. Adrian, welcome, and thanks for joining us today. All right, with that, I'm going to turn things over to Erin and Adrian. The floor is yours.
Thank you, Greta, and I appreciate everyone joining us today. And we are really excited to cover this topic today. This is not Aaron and I's first rodeo in regards to presenting this. We actually recently presented this session at Case Drive. So we're looking forward to engaging with you all today, and also wanted to make this session engaging as well. So if there are any questions, as Greta mentioned, please do pop them in the chat. But before we get started, I did want to ask one question to the group, and if you could respond in the chat with a yes or no. The question is really, how many of you have an existing Grateful Patient program that is currently tracking KPIs? And I know the KPIs can be varying, whether they be just a few or many, but if you are just tracking a few, please do enter yes or no if you're not actually tracking those at this time. It just allows us to understand the audience and also kind of cater some of our content as well. But wanted to jump in here because I know we have a lot to cover today, and really wanted to drive some of the conversation talking about what Grateful Patient Philanthropy is overall. So what we've seen in the industry is, especially in this space, Grateful Patient Philanthropy is really about the patient experience and not all about money. And really, when I say that, a lot of the clinicians that we experience and encounter during our engagements, some of those individuals have engaged with philanthropy, some have not. And you'll probably hear a little bit more about that from Erin, sharing her experience at FNMCW. But overall, grateful patient philanthropy is part of that clinical experience. It's not transactional. I know a lot of individuals think of course, those gifts that are given to institutions as what makes up philanthropy. But we've seen, of course, thank you letters been the expression of philanthropy, or even just having the conversation with the development team to further identify where there are opportunities. And then overall, philanthropy is a natural extension of that patient's clinical experience. So allowing that opportunity for any patient or individual to give back is that goal. And you'll hear more about that from us today during our presentation. Additionally, we wanted to share some of the science behind the power of gratitude. This is one of the elements that we engage with all of our clients on, thinking about how they could tap into that gratitude of each patient and making that connection with the clinical experience. So as you see here, you can see this diagram kind of flows into each other, and this is a basis around Global's best practices and a lot of how we roll out each of our Grateful Patient programs. But what we found is that the patient's experience leads to gratitude, gratitude leads to giving, giving overall creates happiness, and that happiness leads to healing and more of those healthier behaviors from patients. So this is something that we engage with all of our clients on and talk through just to think about how you're setting up your program and moving it forward. In regards to some of the grateful patient outcomes that we've seen, we wanted to highlight a few of those grateful patient outcomes in the grateful patient fundraising space. I know many of you have come today to really identify and think about those metrics in this area, but as we mentioned KPIs, we know that they can go beyond just grateful patient fundraising. But those grateful patient outcomes that we've seen, as mentioned before, grateful people are healthier people. Grateful patients and families often are moved by the opportunity to give back. And then also small expressions of gratitude, as those thank you letters that I mentioned, are those opportunities for individuals to express gratitude. And then really one things I wanted to highlight here is something that we've talked with many of our clients on. When clinicians do not recognize those expressions of gratitude, it really allows those patients to feel dismissed or not providing them an opportunity to engage. But most importantly, clinicians who better understand why patients want to express that gratitude are overall better within their jobs, but also throughout the philanthropic process as well. So making the case for the importance of philanthropy. This is an area that we wanted to review as we've seen within institutions, knowing that the case for philanthropy starts at the top and really having those CEOs and leaders engage with us. And I know within Aaron's experience in FNMCW, this has been a major highlight as well, thinking about how our CEOs spending their time. What we've seen is that CEOs are spending a lot more of their time partnering with philanthropy because of the return on investment. And then also institutions need to identify those priorities for growth, looking at cost to raise a dollar, return on investment, and also investing in the philanthropy team overall. And then also successful environments thrive on a culture of philanthropy. I know you all have probably heard that many times, but with that said, building that infrastructure within the institution allows for clinical staff to engage and really understand how to partner as well. And as I mentioned before, leadership engagement is crucial overall to the donor cultivation cycle. So with that said, I'm going to turn it over to Erin to talk a little bit more about her experience at FMCW and also the reasons why we've engaged together as well.
Well, thanks, Adrienne. I'd like to congratulate Greta as well for pronouncing Freighter correctly. It's a tricky German word, so kudos to you on that. If you want to skip to the next slide, that would be great. So, Frederick the Medical College of Wisconsin is an academic medical center based in Milwaukee, Wisconsin. We service most of the southeastern side of the state, and we had two previous Grateful Patient fundraising program attempts before engaging with Global. So these attempts were not successful because it was not as holistic as we would have wanted. The connection wasn't there with the clinicians. And it was just kind of more, piecemeal we started to do it on our own, and ultimately it wasn't as successful as we wanted. So we were really looking for the expertise in the field when we started looking for a partner to um, really implement a sustainable program that was going to last for, last and be successful for us. And that is how we found Global.
Thank you, Aaron. So with that said, we wanted to also share a little bit more of a background on Global. I know Aaron mentioned the reason why FNMCW came to us and engaged in regards to setting up their KPIs and also building out their Grateful Patient program. But a few highlights around Global, if you haven't heard of us, we're the number one consulting and technology firm within the healthcare philanthropy space. Our team has helped clients generate over $4 billion in philanthropic revenue. And our staff is a little bit over 40 individuals with 750 years of experience. And we've partnered with clients ranging from our KPIs, which we're covering today, grateful patient programs, campaigns, data analytics, and more. So just wanted to share a little bit of a background on Global and our company as well. With that said, I'm going to turn it over to Aaron to just share a little bit more around the KPIs and also reviewing further some of the goals of FNMCW.
Thank you. So we have kind of an umbrella that I think of Grateful Patient fundraising at our institution. So there's this just general Grateful Patient umbrella, and under that is our annual giving lane, and that's we've been doing that, soliciting our grateful patients on the annual giving side for a long time, and our major gifts side. So those are kind of different lanes, and what we were really looking for was being more strategic and in building a grateful patient major gift program, which what we call healthcare philanthropy. So it differentiates kind of, it is overall grateful patient fundraising, but we kind of HCP trademark to differentiate the programmatic, really specific, intentional way we engage with clinicians, pair them with gift officers, and raise major gifts that way. So our goals when we first started working with Global was really wanted to build a scalable and best in class a grateful patient philanthropy program, and ingrain that culture of philanthropy further into our patient population and engage them in ways that they hadn't been before, and also really increase that culture of philanthropy with our internal stakeholders and clinicians at Froedtert and our medical college. So our system uses both direct and screened referrals to track our engagement of our program. So the difference being we analyze billing data and to bring to our clinicians. That is our screened referrals. And our clinicians also have the opportunity to give us direct referrals to patients as well. So wanted to expand both of those lanes. And, as you'll see in the next few slides, we do have some goals around increasing those direct referrals. And then really backing up a really holistic data operations and KPIs behind the program so we can really dig in and see, is this working for us? Do we need to change anything? And Global was, they were the correct partners for us to help with that.
Thank you, Aaron. And just a question back to you, just to kind of set the stage as well. I'm not sure if you're able to share also the resource and tools that you have, especially around your CRM and also the reporting system right now for FNMCW.
Sure. Yeah. So we use Razor's Edge NXT for our database. And then we lay on top of that Click, which is a data visualization tool, I guess you would call it. So we were able to really develop a lot of customized reports that way. Um,
Wonderful. Thank you, Aaron. And wanted to share a little bit of a detail because I know everyone in the audience today, I'm sure, has varying systems, and we work with clients along the spectrum, whether it be from Razor's Edge, Salesforce, and so forth, but just an understanding, of course, of what the setup is before actually implementation, which is what we're actually going to go through shortly here and probably what you all are here for today as well. So I wanted to share a little bit more on in regards to the KPIs that we specifically roll out to each client. And these are the baseline KPIs that we have established as we begin building out a Grateful Patient program. As I mentioned earlier, there might be more that you encounter. I know some of our other clients are starting to track maybe interactions and meetings with clinicians, but at least these are the baseline metrics that you can set up as you're thinking about building out the program. But with that said, those key staple Grateful Patient KPIs range from number of champions, number of champions engaged. And when we think about the number of champions engaged, that's a specific classification that we assign to each one of the clinicians, whether they be prospective, engaged, no longer a part of the program. So there's some other definitions that we have behind the scenes. And then also looking at the number of referrals. As you can imagine, the goal is to get those referrals, whether they be direct or indirect, as long Aaron mentioned. And then the number of qualification visits, number of prospects qualified, number of solicitations, value of solicitations, number of gifts closed, value of gifts closed. And lastly, but I will say probably most importantly, are those additional gifts. Additional and secondary gifts are another key metric that we have established with clients because it provides you the opportunity to look at those lower level gifts that might be coming in. As you begin to roll out your program, you might see some of that revenue is not at that major gift level, but you still want to track that overall. And I know, Aaron, within your institution, this has been helpful and also has been able to kind of bring up that amount of revenue that's been raised.
Absolutely. This was helpful for us to add this last year. We were only tracking major gift opportunities on record, but adding the secondary and additional gifts layer really gives us a better idea of, additional smaller gifts that prospects might be giving, or just other things that they're inspired to give, and we want to capture that. We found out about them because of their gratefulness through our healthcare philanthropy program, so we do want to continue tracking on their gratefulness journey.
Absolutely. Thank you, Aaron. And of course, please do put in the chat if there's other metrics that your team is utilizing right now, or if you have questions, we'll definitely address those later on as well. All right. Another area that we wanted to cover as the basis of setting up the KPIs in the beginning, we also work with every client to build out a tracking your success guide. And really through this process, it provides the opportunity both from the operational standpoint to measure the program, but also allows the gift officers and frontline fundraisers the opportunity to better understand what is the database infrastructure, how are we implementing this, and I definitely recommend in as many spaces as you'll be able to cover this or review with the team. It provides more of an opportunity for the whole team to understand this cycle. But as I mentioned before, of course, we have our KPIs that are developed, but there's also the tracking your success guide that covers the engagement process, the fundraising software, basically the CRM, and then also looking at the KPIs that are integrated within this overall. So this is just a preview of what that tracking your success guide looks like, but all of these elements are very crucial and essential to be able to track the program performance, but also look towards the future as to where you're going as well.
Wanted to add in here, Adrienne, the training manuals are kind of boring usually, but I cannot stress the importance of this tracking your success guide. Um, it's the meat of how the program runs. So I still regularly refer back to things. It totally lays out like this is how you enter things. This is exactly what you do. So it's an invaluable resource in setting up a really sustainable program. And this is
Thank you.
something that was lacking in our previous attempts, like the documentation and procedures.
Absolutely. And thank you for
Mhm.
that, Aaron, because one of the things that I know you and I have worked together on as well is, as you all can imagine, rolling out this guide is that moment in time. But as the program moves forward and things change, or there's other additional aspects that you want to integrate, this guide, of course, will be updated and it's a little bit more of an evergreen resource. So I know Aaron and I partnered together to conduct refresher trainings for the team on the Tracking Your Success Guide to just help everyone understand where we are at this time.
Yeah, the one source of truth for sure.
Absolutely.
Hey, Adrian and Aaron, we have a question I was wanted to throw out to both of you. And if it's going to be answered later on in your discussion, by all means, we can put a pin in it. But I thought it was an interesting one that I thought I would share now. Do you
Absolutely.
find that nurses and other clinical staff are equally as important as physicians to serve as clinical champions, or is that not the audience you should be engaging?
I can go first on that. I think that nurses and other technicians are sometimes ex maybe even more valuable. They have more interaction with those patients. We're actually about 6 months into a pilot, our first foray off of having our MD clinicians be the champions. We're piloting a project in our cardiac rehab group where we trained a group of 4 nurses and cardiac technicians that have many encounters with patients over a really brief time. I believe it's 40 to 60 visits within a 3 to 4 month span. So they're getting to know these patients really intimately, and it's life-changing work that they do. So the gratefulness there is overflowing, and we're seeing really great success in this pilot. There were some challenges on the back end implementing that, I'll be honest, because since they're not getting billed to a particular MD for that work, we can't get them billed or indirect referrals, screened referrals. So we rely on that group to bring us the direct referrals. Like Sally was in, I think you should talk to her. But we walked in to train them, and they have 3 full huge boards of just gratefulness, notes, cards. Thank you. Like, you changed my life. I can breathe again. I can walk up the stairs. I can hold my grandchildren. So that was a really great foray into non-MD clinicians. And our next step will be looking at mid-level providers, APPs. So that will be a similar type of process for us. Good question.
Adrian, do you see the same thing across, all the clients that you work with, or is there a more concerted effort to engage nurses and other, non-doctor clinical champions?
Absolutely, 100%. And I also echo a lot of things that Aaron mentioned. This was actually a conversation from an on-site visit that I had recently with another client and discussing the opportunity to train nurses because really at the end of the day, they're another connector. And within this kind of industry is being able to understand how are you connecting with that grateful patient, and every individual among clinical staff is a part of the team.
Yeah, I always think this is a funny, or not, maybe funny is the wrong word, an untapped opportunity for so many of our colleagues. My running joke was always that like I had a much stronger relationship with my physical therapist than I did with my orthopedic surgeon. I saw that guy once, and I saw my
Yep.
PT 3 times a week for 6 months,
Yep.
right? So that person knows me incredibly well, and that's the relationship that I have. So always thinking about how do we leverage that in a more holistic way to really capture that patient experience and really facilitate the realization of gratitude, which is really exciting.
You built a new bestie.
100%, 100%.
Yeah,
And
I
I
think
think
that's so important. I appreciate the question.
Absolutely. And I would say that also relates back to, as I know we'll talk more about KPIs, but I also think of that as we've shared with you all the baseline KPIs, but as we think of those other areas, what are other KPIs that would be relevant or customizable that fit your culture for sure? And whether it be looking at nurses referrals or things of that nature, there's that opportunity to expand.
Mhm.
Okay. Any other questions right now, Greta? Okay.
That's it for now.
All righty. Well, I know we set the baseline sharing a little bit more around the KPIs, but we also wanted to talk a little bit more of the team and thinking about both the operation side of the fence, but also the frontline fundraisers. So those key drivers that are associated with the KPIs and also just overall the program, we wanted to review, and there's two buckets that we look at those from. And one side of that is looking around clinician engagement. And the other side are from the frontline fundraiser, development officer, gift officer perspective. So some of those drivers that we focus on with on the clinician engagement side are looking at number of champions identified, number of prospects cleared, and number of meaningful interactions. And I just do want to take a moment to talk about the number of prospects cleared because it is very important element that I've talked with many of our clients on. Because when you're thinking about the grateful patient space, I know everyone's portfolios are a mix. So grateful patients might be just maybe one portion of that. So having an understanding of that clearance process with the faculty member, but also from a prospect management standpoint of knowing is that individual in a portfolio? Are they currently managed? And just making sure that overall the team's not tripping over each other in regards to managing those individuals. So I just wanted to state that as I've talked with many of our clients on that note. And then when it comes to the frontline fundraiser side of things, looking at the number of prospects identified, number of prospects qualified, and then also number of meaningful interactions. And then a few others are looking at the time spent in stage. I know when from an operations standpoint, this might be a little bit more challenging depending on the system that you have. But if it is possible to track, we definitely recommend that. And then looking at the number and total amount of gift asks, along with the number and total amount of closed gifts. So all of these elements are working together with the KPIs, but I think when we think about these key drivers, it makes it a little bit more real for the frontline fundraiser, and then also those individuals focused on that clinician engagement. So I just wanted to share this exercise as well in
Hey, Adrian,
regards.
there was do you want to
Okay.
go back one slide?
Oh
There
yeah,
was
absolutely.
Susan submitted a comment. How do you count qualified in-person or virtual meetings or qualified based on research data?
When we think about quality, this is a great question. And I know a lot of our clients are focused more on those in-person meetings, being able
Mhm.
to know that that is a truly qualified individual and that visit has been made. And being able to actually move them through the moves management cycle in a meaningful way. I know some of our other clients have looked at those as kind of objective-driven conversations versus more of those email sent that is not actually kind of maybe moving the needle. But I'm not sure, Aaron, if you had any other notes there too from that.
Yeah, I agree. We count in person and virtual, or even phone in some cases as a certified qualification. Like email exchanges or text exchanges are, not meaningful interactions. So it can, I think those are helpful to get the in-person or virtual meeting. But for a qualification, that doesn't qualify for us.
Totally. And I will extend upon this to actually relate to something that we had mentioned earlier in regards to tracking the KPIs, because I also would say, depending on your CRM and the database that you're utilizing, a lot of the front end work that we work with Aaron and other of our other teams on is identifying what that mapping looks like because of those different actions and the coding structure. So I think that's very important as you begin to set up these KPIs and thinking about those qualified prospects and what that actually looks like.
As a follow-up to that question, I'd be curious from both of your perspectives if you see trends or anything trending in terms of how donors want to engage, with your gift officers. If there's, we know that in the post-COVID world, the rise of virtual engagement has happened everywhere because everybody has this capability now. Everybody has these tools at their fingertips. But I'm curious if it's just the post-COVID world or if you're just seeing trends with, younger donors or different types of donors in terms of how they want to engage. Not to mention the fact that like budgets are tight and sending people everywhere and anywhere is often not necessarily, a possibility. So just kind of curious if you're seeing that trending happening as well.
Like directly post-COVID, I think a lot of people were realized the convenience of virtual meetings and really wanted to leverage that. But it's interesting that you asked that because I have noticed in the past year or so the shift to wanting more, craving that in-person contact. I myself also crave that too. So I was so happy when we went to a conference in person and got to present the same information. So it does seem like there's a shift. I don't have, rock hard data to support that, but it seems like a lot of our prospects are like, hey, let's meet up for coffee or, let's grab lunch. I'll be at the hospital, whatever day.
Absolutely. I'll also say the same around that, and to think about the other side of the fence, especially when it comes to clinician engagement. I know that's also an idea of thinking about how you're partnering with those clinicians because there's a varying way of how they want to partner with development. And I know that's one of the things that we also share during our grateful patient trainings is to establish up front how they want to interact with you, whether it be sometimes people like want to just connect via text, but also truly the manager of being able to get that in-person meeting with that clinician or faculty member is more important because you're being able to build that relationship and rapport.
Really encourage our development officers for the first few meetings with new clinicians to really push for that in-person meeting to create that sense of trust and build that relationship. And then, if you want to go to virtual or anything after that, that's okay. But establishing that really great relationship up front is super important. And it's just harder to do when you're virtual. But of course, we respect the clinician's time. They're overscheduled and busy and they're saving lives. So we certainly respect their time.
I brought great questions. All right. Well, one of the other areas that we wanted to cover was talking through a little bit of a KPI exercise that we roll out to each one of our clients as we start to build out the program. And this is really associated with thinking about what is your institution's goals and how can they be built into the infrastructure and build of the KPIs. So, what we share in some of those questions that we would ask are, what is your revenue goal? What is the current average gift that you are receiving? So, taking a look back by maybe doing a gift band analysis or another analysis to just look at what that history looks like, along with how many gifts do you need to reach your goal? How many asks do you need to reach your goal? And then also, how many visits do you need to close a gift? All of this in partnership with prospect management is very important to think about what we can build and what is going to look towards the future as you think about iterations or changes after you've launched the KPIs. And each one of these data points and questions really helps to inform their success and identify what that looks like for you. And then we also recommend integrating conversion rates. I will say that before integrating these conversion rates, take that first year to look at how the programs operated before assigning those because it allows you to get that baseline. Because I know everyone thinks about benchmarking against their peers, but every institution is different. So allowing you to be so you'd be able to get that under your belt in the beginning allows the opportunity to take a look back and then project towards the future. We wanted to share a little bit more around the prospect management best practices as you're building out these KPIs. And looking at the prospect management perspective, some of those best practices that we recommend looking at are defining who is responsible for tracking measurements and how. And then most importantly, measuring what you value and value what you measure. I know at the end of the day, sometimes institutions and individuals think we need to track everything underneath the sun, but is that actually providing value or is it moving the needle at the end of the day too? And some of those questions that I think to ask, how will this be tracked in the database or CRM? What metrics evaluate the inform basically the frontline fundraisers work? Thinking about those qualification visits. I know some of our other clients have expanded it that think about what does new qualification look like, actually bringing in those individuals who might not have had any interaction with development or new to development to be able to get that diversified revenue. And then also, how are you planning to extract this data from the system? As Aaron mentioned earlier, they're utilizing Click and also Razor's Edge, but that varies among each institution. All of these questions are important to build out the KPIs and also from that development standpoint. So We recommend reviewing these before implementation and then also even reviewing them post or also and even during because it allows you to get that frame of reference and roadmap to think about what is most valuable. So I'll turn it over to Aaron to share a little bit more around the challenges and also the impacts and successes that they've seen through building out their KPIs. And I'll turn it over to you, Aaron.
Yeah, thank you. So we're seeing great success with our program. I'm so grateful for that. But we have had our challenges along the way, and we certainly have opportunities for growth in the future. So I just wanted to go over a few of our top challenges, with the number one being, clinician availability. What we ask of our clinicians is not a lot. When we invite them to the program, we ask them for, they're not asking patients for money. We ask them to just listen for gratefulness cues, just like they do every day with their patients. They listen for cues about their conditions and, to uncover what's going on with their bodies. We just ask them to listen for gratefulness cues, and keep that in mind when they're meeting with their patients. So listening in a different way. And we ask them for a half hour of their time every month or every other month to meet with the development officer that is assigned to them and to go over those patients who to potentially reach out to. So that's what we ask of our clinicians. And I think that starts with having strong buy-in from clinical leadership. So we were really grateful to have both our academic side and then our clinical side on board with this program when we launched it. And they helped to get the word out, communicating how important philanthropy was and how it's increasingly important in our landscape, of NHI grants getting cut and funding cuts and costs rising. So clinician availability is a big challenge. I'm not going to lie. They're always going to be busy. And so coordinating schedules with busy clinicians requires some creative thoughts and from our gift officers. So, like if it means, coming in at 6:30 in the morning to meet with them before they get going in clinic, that's what it takes. If it's meeting after hours or just having a quick phone call, that's okay too. We meet them where they're at to make it convenient, and we don't want this to be a burden to them. And then, they once we establish that relationship and they go through the first couple of cycles with like seeing like, okay, like my development officer is going to reach out to these patients, and then they report back to me like what the conversation was, or if any gifts are potentially on the horizon. They get more comfortable with it as time goes on. It's a lot of qualification work too. This work is getting a lot of no's, getting a lot of people that just don't respond. So that's the work, right? So it is tiring, and our gift officers, it's it's the stamina that is required for the massive qualification work is, you need to be prepared for that. But when you get that first gift in from a grateful patient, it's really rewarding for our gift officers. And I think that helps to keep the motivation going. But this requires really good data. We want to be giving them the best prospects possible that are the most likely to, provide a gift out of gratefulness. And also turnover with both gift officers and clinicians. There's opportunities all over the country for both, development officers and clinicians. So turnover just requires having a strategy for when those people fall off of your docket. Like, how are you going to replace that? And what's the plan to move forward? I think the last stat I heard was that the average development officer tenure was about 18 months. So, that means we're constantly looking for new talent and then getting them on board and having them develop those relationships with clinicians. So having a plan for when that's inevitably going to happen is super important.
We've had a bunch of questions come in about this
Oh,
slide.
yeah.
So can you estimate, Erin, what percentage of a gift officer's time is spent working their second portfolio, being their clinicians?
Oh, not a lot. I would estimate less than 10% of their time would be spent managing their clinicians and meeting with them. As for the prospects that come in through HCP, we don't really count those as like a separate lane in their portfolio. That's just their portfolio. And we have 11 gift officers, and they all have a varying level of HCP responsibility, but that's an expectation for all of our gift officers.
So, and with the qualification kind of pillar here, what are you using to kind of help your gift officers with gathering data? So, be it, I know, what are you scoring? Are you rating?
Mhm.
How are you identifying inclination as well as capacity? Like, what are you doing with the data to help guide the
Sure.
qualification, given that it is a grind? We know it's a grind.
Yep.
But
Right.
having some intel helps to prioritize time, right?
Absolutely. So we have some, data qualifiers before we even pass along patients to our gift officers. So if they just see a clinician one time, that's not gonna bubble them up to the top. So the number of times that they're seeing a provider, the recency of seeing the provider. So if you saw a provider 2 times 3 years ago, that's your experience has been forgotten by then, even if it was an amazing experience. So those are two of the like really easy things that we weed out of our data right away. We look at affinity to our institution, and we also look at capacity scoring. We use iWave for capacity, and so those are some of the ways that we trim down the data. So we're only bringing forward the most qualified prospects to our gift officers that would have the highest probability of a return for us.
Awesome. Thanks.
Questions. I love it. Do you want to head on to the next one, Adrian? So here are a couple of stats on our program impact. We launched this in the beginning of fiscal year 24, and to date, we've raised over $12.5 million. So really, really excited to see this growing, and we just got a $1.5 million gift last month, so that helped that number. So it's really just fulfilling to see like the work that you put in, in developing these relationships, and to see it paying off, because it's not, it doesn't pay off right away. Like, people aren't just going to give $1 million overnight. It takes time and it takes patience. It's really helpful to see that. Our average gift size about 250K. We have 93 clinicians that we've onboarded since the start of the program, and we have about 20 more in the pipeline. Our limiting factor with that is our availability with our gift officers. So we just onboarded 2 new gift officers in the past month. So I am looking forward to getting them started with HCP. Next slide. We do have a case study out there. You can use the QR code right here. It details a lot of what we talked about. The numbers aren't quite updated because this was last year that we launched this. So we have our numbers changed a little bit, but the core facts and the basis of our program has not changed. So invite you to download this free case study, and happy to answer any questions on it or anything that we talk about in our webinar today. I love talking about this stuff. Next slide. Ooh, our donor highlight. So Alice is a great case study I love talking about. So she came in really early in our program. She was a referral from one of our clinicians, and she was rated very low. She was rated under $5,000. So our major gift officer was a little hesitant to even reach out to her in the first place. like we do hear some of that feedback sometimes, like, oh, is it really worth my time to reach out? And our answer is always, if the clinician trusts you enough to give a name, like we need to be honoring that and reaching out to every single patient that they refer. So Alice had never made a gift to our institution in her life. So the gift officer reached out in late 2024. Her first gift was $500. So I think that's a great start for a first gift. And then in early 2025, she made a $7,000 planned gift. So that was really quick turnaround for a planned gift. So super appreciative of that. Later that year, she made a $121,000 planned gift. And then early this year, she made a $334,000 planned gift. So she's now north of $520,000 lifetime donor in the course of 2 years. So it's really a lesson of like not judging a book by its cover. You know, she was rated really low, but she had a great experience. She had life-changing care from her clinicians at our institution, and she really found great value in giving back and expressing that through philanthropy.
Thank you, Aaron. And I also would share that, of course, from the frontline fundraising perspective, being able to engage and cultivate that individual, but of course, the database infrastructure and also everything on the back end to be able to kind of track those gifts and also provide all of those data
That's,
points to help move the individual through the cultivation process into making a gift are very important and all relates back to the KPIs as well, what we mentioned
yeah,
today.
it all comes back to the data. Yep. And then just a little snapshot of our reports library. We have more than this, but this is kind of the top ones that we like to use. So just kind of breaking down like overall progress, kind of referral metrics broken down by clinician, and the statuses that different prospects are in. So we track a lot of different things. We're fortunate to have really rich data, and we can slice and dice whatever way we want. So here are some of the most important, most helpful reports that I like.
Absolutely. And I will say that Aaron and team at FNMCW have a robust library of reports, which is great. And I think it allows those individuals to identify and look at data in different ways and being able to slice and dice it, as she had mentioned. So this library is great and definitely something to recommend as you start to build out the baseline of your KPIs. What does that future look like?
Yeah. And then just a snapshot of our program dashboard too. So you can see our actual total raised. You can see our solicited amount closed and then our unsolicited. So that's what we were talking about earlier with the secondary gifts, which we weren't tracking for a long time, that 447,216. So those are gifts that came in through our HCP program. Like they wouldn't have necessarily known about us had it not been through this program, and they made a first gift through a solicited gift, and then they chose to continue their giving. So I think it's a really important metric to capture. Then you can see under those metrics the number of actual gifts closed, 49 solicited gifts, and then 160 unsolicited of those secondary and additional gifts. We have 885 total patient referrals. We have 11 development officers that are assigned to HCP clinicians. And yeah, the bottom stats on here are opportunities for improvement for sure. So I would like to see that average days of our introduction letter from the clinician introducing our development officer. I would like to see that closer to, less than 3 weeks. It's at 56 days right now. So certainly an area of improvement that we're working on. Our average number of days from that letter being sent to qualification action is 149. That would be amazing to trim that down too. But, it's Rome wasn't built in a day. So, we're always looking at doing incremental changes in a really realistic way. So we're not going to change everything overnight. So making small improvements, picking areas that we want to improve, focusing on that and moving forward. Greta, you came off of mute. Was there another question?
Yeah, just a couple quick ones that I think we'll dive a little bit deeper here. How many physicians are each of your 11 gift officers working closely with, or clinician
Here,
champions?
it varies. I think 14 is the most for one of our gift officers. And then some of our newer gift officers have like one or two, and we're building up their portfolio.
Sure.
So it
And
is variable.
yeah. Are you working only with clinician referrals, or do you also screen patients like through like, regular influx of patient data and then kind of work backwards to see where the clinician connection might be?
Oh yeah, we that's where the majority of our data comes in is through our screen referrals. So we get tens of thousands of records every single month from billing. That's why we, put it through our um, uh, paces of our data scraping, I guess you could call it,
Sure.
or qualification to see who's going to be the best candidates to move forward because it's really move everybody forward is just not doable, and
Absolutely.
it wouldn't be smart anyway.
Right. Thank you.
Mhm.
Wonderful. And absolutely agree from that prospecting perspective, both from those direct and screen. But as you all know, the value of those direct referrals is just much more magnified because of being able to identify them from the clinician. But of course, that proactive side to be able to go back to the churn that Aaron mentioned earlier from a qualification, being able to well screen or just identify those individuals through assigning some of those data points just allows that opportunity to continue to build and flow the pipeline. All right. Well,
But we
just
have some future
oh,
enhancements. Do you want to get started or should I?
oh, go ahead, Aaron. Yeah.
Okay. So, our future enhancements are, one of them is what we call priority prospects. So, high capacity prospects that come in that are not seen at HCP trained clinician. I just saw a question about this in the Q&A. So, great question. So we call these priority prospects. We're rated anywhere over 1 million plus capacity. We're defining these as. So our first iteration of this, we piloted it last year, and where we kind of modeled this our HCP process where we send out a letter. The letter just came from like a leader in the clinical space, thanking them for trusting us with their care. It doesn't reference their attending doctor because they're not trained into the program. That honestly was not very fruitful for us. I think the connection with their attending clinician was not there. So we are rethinking how we handle these. And it will probably just be a more of a traditional kind of major gift pipeline, hands-on approach instead of modeling that our HCP process with sending a letter from your doctor and everything. So it seemed a little too transactional for at how high these prospects were rated. And then we mentioned this a little earlier was expanding to additional service lines. We're piloting the cardiac technologists and nurses right now. APPs are next on the list to expand into. So really kind of thinking who else can we partner with who sees patients a lot and has those great relationships.
Absolutely. And the last one I had here too is just looking at those filter enhancements, which Aaron and I have conducted on before previously, and I talk with a lot of clients as well. As you get more data points or add them to the KPIs, what is that a data point that you wanted to filter on? Just making that decision and being able to provide that flexibility.
Yeah, so to wrap up, some lessons learned. I think one of the most important lessons is that, having that strong clinical and leadership support is super, super important. Executive champions really accelerate the adoption, can talk with clinicians, clinician to clinician, and, to really show that we're all one team and we have the same goal to really ramp up our philanthropy for our institution that we all care about. Consistent training is another one. Even though your development officers and clinicians are onboarded once, regular refresher trainings are really important to help teams connect back to the why, like why they're doing it, and also just a reminder of process and operations kind of things. And also, I think Adrian mentioned this a little bit earlier. There's lots of data that you can slice and dice any way you want. And it's really tempting to just want to see everything all at once. But I really encourage you to start small, think about what really matters first, and then you can expand your KPIs. So really just starting with a few of the meaningful KPIs that you think would be helpful. And then as time goes on and you see how it goes, then add more. Because maybe it's going to be different than you think. You'll not being iterative and flexible is helpful, and celebrating early wins. Sharing success stories with the team, patient stories. It reinforces behaviors because the qualification work is taxing. So really sharing the small wins, sharing small gifts that come in, sharing celebrating big gifts that come in, celebrating that you got a coffee meeting with someone. All of those things are important to celebrate at any time, but especially early on as you're building a program.
Wonderful. Thank you, Aaron. And as we wrap up today, we wanted to share a few lessons learned as well from the operations and data infrastructure perspective. A few of those that I wanted to highlight is that transparency builds trust, being able to be upfront with where you are and also sharing these reports among the whole team helps get that buy-in. And then also integrating KPIs into existing workflows and reference them often. As I mentioned, I can't say it enough. The more it's in front of individuals, the more they're paying attention to it. And then also creating a feedback loop to allow opportunity for enhancements. And then overall, just some of the key takeaways that we wanted to share with everyone today are really the fact that philanthropy is a part of patient care, being able to understand that clinical experience and making those connections. And you can't grow what you don't measure. So being able to stand up these KPIs and then evolve them over time is very crucial. And then dashboards don't change culture, people do. So every one of you is very important in regards to having an element of what's influencing the KPIs, but also building out what the philanthropy team looks like in the future. And then, as well, FNMCW's results were not just luck. It was built and based upon a process and also the execution that Aaron and team have developed and the expertise they have within the industry to build something that's sustainable to this day. And really, from the case study, as we mentioned, they were just a few months ago at 10 million, but within these few months have now even grown the amount of revenue. So, really wanted to share some of those key takeaways and greatly appreciate the opportunity for us to join you all today and also to have you be a part of this conversation as well. But I'll turn it
Yeah.
over to Greta.
I think
I see Jessica's question. I wanted to be sure to answer Jessica's question that came through the chat. She asked, what does the process for patient outreach look like? So our process is the first outreach is a letter from the clinician introducing our gift officer, saying they're going to be reaching out within a few weeks, and giving many ways to opt out because we don't want to conflate getting quality care with like talking to an advancement officer. And like we also, if someone's saying something to like in clinic to their physician, like how can I be involved? We also developed postcards that clinicians can hand out. It's like I would love to connect you with my advancement colleague. Erin will be reaching out to you. You can reach out to her. So look, a couple of different ways, but typically our first outreach is a letter. Good question.
Thank you both so much. We are so grateful that for your time, your expertise, everything that you brought to the conversation today. As I mentioned, we're going to be sharing the slides and the recording from this session with everyone, and I'll make sure that we also include a link to the case study that Erin referenced, so you can get to know a little bit more about how the program was formed and how it's going. And if you're, in the beginnings of this as well, and you want to talk to a global expert about how to get going with grateful patient programs, or you want to refine your KPIs and think more about how to improve what you already have in place, by all means, we're here to help. Feel free to scan the QR code or visit our website, globalgroup.com, anytime. Reach out to us. We're excited to help. All right. So I think that's it for us today, and we're right on time, which is always wonderful. So thank you again to Erin and Adrian for sharing all of your wisdom and your knowledge, and thanks for everyone for spending some time with us this afternoon. And good luck. We'll see you soon.
Thank you so much for the opportunity.